Today I'd like to begin, as I always do, with our numbers. At this moment, earlier today when we finalized our statistics at 2, we had 442 cases. As I've said all along, we are very limited in our testing right now. We do have many pending testing kits that are at private labs, but we do know our starlight from the past right now has 442 cases in Ohio with an onset of February 7th to as recently as March 23rd. Our age range at this point is from less than 1 year, we classify all infants as less than 1 year, to as old as 93 years of age with a median age of 52. We have 104 hospitalized and 6 deaths to report. We have others that are under investigation. I say that because I know often you're hearing things in the media at a local level before things are confirmed in our state system. So I just want to acknowledge that. Even my statistics I give you are shot in time. They're not what's happening hour to hour. We have 46 of our counties reporting cases and community spread at this point. And we have numerous clusters that are under investigation. I want to talk about a couple things today. First of all, I do want to talk to our nursing home colleagues out there. I've had the good fortune of talking to some of the nursing homes. I'm hearing amazing stories from the front lines of folks doing really incredible acts of courage and kindness, from people coming by and visiting and doing things in the windows that have really lifted the spirits of the staff inside. We have, in some of these clusters, over 70-some people involved, so that's a number of staff, so there are less staff, and those staff are working tirelessly to really take care of those residents. And I've spoken to some of you on the phone. I've always said all along, all the social media, this isn't about me or anyone, it is about all these heroes that we're hearing about on the front lines every day, and certainly the folks in our nursing homes are just doing a heroic job. And my team back at the EOC is supporting them as they need guidance through the decisions they're making. So I just want to acknowledge that. I want to say something to our hospitals. Thank you again. We're working with you tirelessly, and starting tomorrow, we're going to be doing more data explanations of what our capacity is within our hospital system. You see that happening in some of the states who are ahead of us. And we're going to start giving you some of those daily updates on numbers and graphics. Our hospitals have been hard at work creating a cohort system and getting that data out with us. So stay tuned. But a very important thing to our hospitals, we're doing some testing in-house. We're doing some through private labs. Those private labs are lagging quite a bit. So we really need all our hospitals to report ASAP their data to the Ohio Department of Health and the CDC. We have to know the results of those tests as they occur. It really helps us do our work a lot better. To our primary care docs and other practitioners out there, we're going to be giving new guidance soon, but I want you to think about treating this virus, most of whom the folks will be treating are at outpatient basis. I want you to really take advantage of the telemedicine and phone flexibility that my great colleagues have created for you. What we want to do is take care of that 80% of outpatients the same way we would take care of stroke and MI. We have to, here on the fly, create a system of timing is everything. The same way that every minute matters, that is true for treating coronavirus. So we want you to do a great case history. If there's anyone at home sick, in the household, or the individual is sick. So don't just ask about the person, ask about everyone in their household. Anyone sick needs isolated, and folks exposed in that household need quarantined immediately. You don't need a test to do that. Treat it the same way. We got to get in that same rhythm. You go in an ER and in 10 minutes you have to have done an EKG. Well, at home, the second a patient reaches out to you, even without a test, do that history, get them in isolation and quarantine at home, tell them what to look for worsening symptoms, and keep in close contact by phone or through telemedicine tools. Everything we can do without having face-to-face is important, because we now know that some of the greatest spread is coming in our nursing homes and hospitals and in our visits where we're keeping on short PPE. We know that we can have potentially a provider going to multiple nursing homes and then going to the hospital, and that has been a source of spread we're learning all around the country. But then the more you can keep patients at home and not in your waiting room and conserve that PPE, the better. So that brings me to the next thing, our PPE. My team for the media is putting together some numbers of the PPE. We have a very limited supply we have received federally, and we have a small stash that we had here in our I should say cache. I always want to say stash, but it's cache is the formal term here in our state. We are getting that out to our local health departments today. We'll give you more on that. We're saving 20% back, but everything we have is going out today so that we can arm folks on the front lines. In the meantime, we're waiting federal shipments of more PPE, which we need desperately, and our businesses here in Ohio are starting production and working on ways that we can create our own. But we've got to get out what we have right now. Local health departments, I spoke with you all on the phone late last evening. We're getting that to you. But I have to tell you, don't be surprised. We're talking small boxes. We're not talking truckloads of PPE. That is the truth. That is reality. We'll share those numbers with the media. I don't have them on me, but we're getting everything we have out to you except a very small amount. We're holding back for some of the clusters and really acute situations. The game of all of this, folks, and it's so important, and I'll go back to our curve. We are clearly moving up our curve. And you're hearing a lot in the media right now, different people who do sort of the modeling that we've been using as our guidance. And I want to talk very, very specifically about the work that was done by David Katz, New York Times editorial yesterday. So it's really important for folks out there doing this modeling to talk to those of us on the front lines. There's a world of what is ideal, and if we had time to build it, and then there's a reality of what's happening on the front lines. We are in a situation in the short term where we have to do everything in our power to get people to stay at home. We have absolutely got to slow the spread, which we can only do by really great contact investigation and testing, which we have very limited supplies of, and by keeping people doing social distancing. The lockdown that you're hearing about that is going on, which is really our stay-at-home order, is crucial in these next few weeks. There will be phases to this, but when you look at where we are here in states right now, we have got to stay home while we build up the other side of the equation. Stop transmitting, stop spread, other side, build hospital capacity. We know that we have an extensive shortage of that, and we are working tirelessly on getting supplies to our hospitals, getting new personnel out of retirement, med students, and building up our personnel, and literally building hospitals and beds. That is the equation. That is the playbook in the war right now. There's a false equivalency about every one of these decisions is either health or economics. They are both. They're inextricably linked. And so the things that Dr. Katz is talking about are crucial pieces of a puzzle, as well as learning from some of the apps, technology, the blood testing that is available in other countries like Asia, like Singapore and South Korea. But those are not apples to oranges of where, it is apples to oranges. They are not equivalencies of where we are now on the ground. We are slowing it down and shutting it down for a short period of time while we build that capacity, and then use those techniques you're hearing about. Herd immunity, yes, some of us will get sick, and when we're on the other side of it, we have got to get those folks back to work. So all of that is the next stage of a response. It is the next stage in how we will eventually exit out of this. But the truth is, and people at home, please hear this, the most important thing we can all do right now is stay at home, unless you are absolutely essential to those lifelines of food, water, the transportation that supports that, our healthcare services, our frontline workers. That is our tool chest right now in the real world that we are living in. And again, I implore, and many of us are working, I'm talking to scientists, I'd love to talk to Dr. Katz and others. Let's use those things like herd immunity to help us unwind this. Let's use, once we have all the extensive testing and apps to trace who's already had this, our way out of this as quickly as possible so it has the minimal economic impact. But the truth of the response now is absolutely what we're doing, and we have little time to spare. Thank you.